Hi, my name is Jimmy Lyions. If you're watching this video, then you've chosen to start or continue living an active lifestyle by undergoing a total joint replacement. I'm very excited for you that you've made this decision for yourself. There is work to be done to reach your goals. The purpose of this video is to help decrease your anxiety by understanding the process of your joint replacement more thoroughly in the comfort of your own home, while also managing your expectations of what the post-operative recovery will entail. Getting your joint replaced means a lot more than just pain control. Living an active lifestyle has a rippling effect not only on your physical and mental health, but your overall wellness as well. Everything from diabetes to heart disease to depression are all managed better if someone is able to move and be active and interact with others in a much more meaningful way. It affects your relationship with other people if you feel better about yourself and are able to do activities that you enjoy. With this video, I'm hoping that you and your family can go over this information that comfort your own home and have a better understanding of what the overall total joint replacement process consists of by knowing what to expect before, during, and after your total joint replacement. It is a big commitment, and there is a large team of people making this go right for you, all the way from our staff here in the office to nurses at the hospital, other physicians. I do feel the better you're educated on the process and the more you understand, the less anxiety you'll have about it, and also the better experience this will be for you. So let's get started by looking at some x-rays and go over what arthritis looks like. Here's an x-ray of a shoulder with arthritis. This is a good representation of what we're looking at to know that your shoulder has arthritis. Again, arthritis is the loss of cartilage in the shoulder, in the joint surface, and you can see between the ball and the socket there should be a space. When you lose your cartilage, the bones essentially get closer and closer to each other, and that's why we say people have bone-on-bone arthritis. At the top here, just above the ball, you have your rotator cuff that attaches right in this groove here. That is still well intact, but we have a very arthritic surface. And you can see down here at the bottom of the head, the humeral head, there's a big bone spur that almost looks like a beard. That is also a good sign that there's significant arthritis in this shoulder. Again, this is the socket, this is the arm. The socket is part of your scapula bone. Now I'd like to go over the process for your total shoulder replacement. First, we start off with an incision over the front of your shoulder. Here we have the scapula, which has the socket, and then your arm bone or the humerus, which will have the humeral head or the ball part of the ball and socket joint. Once we come into the shoulder joint, we do make a cut and remove a small portion of the bone here. Then we take this prosthesis that has a stem. This goes down the hollow portion of the bone and gets fit in there very, very tightly. So snug that we're not able to really move it anymore because it's wedged in there so tight. We then put this cobalt chrome head on that is measured or placed into your shoulder according to the size that we need. So this can be changed accordingly. Then on the socket side, you can see here we really just clean this up by freshening the bone up to get rid of the arthritis. Really don't remove much bone at all. And then we place this plastic piece, and this gets bonded to the shoulder with even some cement. Here we then are able to have the shoulder then articulate, still using all your own muscles to stabilize the shoulder. And you can see here that you'll end up with an artificial surface that articulates with each other. Now, because you're still using your own muscles to move the shoulder, it's very important after surgery for therapy to really strengthen up all these rotator cuff muscles. And that's how your total shoulder will look after it's been performed. This is a post-operative x-ray of what your shoulder will look like after we've replaced it. You can see, as I showed you in the model, there's a stem that comes down the hollow portion of the bone, and then we fit this metal head on top of that. On the socket side, you can see a metal post, but here what you can't see, there is that plastic piece that doesn't show up on x-ray. So now you have the metal ball articulate against the plastic. You still are using your own rotator cuff to move the arm and stabilize the shoulder. And typically after surgery, strengthening the rotator cuff is very important to have a proper functioning shoulder replacement. All right, now I want to talk to you about pre-operatively. After you've been scheduled for surgery, there are a few things we need to do to get you safely ready for surgery. First, you will need clearance from your family physician to make sure you're fit for surgery. Pre-operatively, we will also get some tests that may include some basic blood work, a urine sample, and a nasal swab to make sure you're not carrying any concerning bacteria that could cause a problem with infection after surgery. We do this to decrease any risk of infection or post-operative complication. The night before surgery, we ask you to shower with a special soap the night before and also the morning of surgery. We ask that you put clean linens on your bed. Again, this is all an attempt to minimize any risk of infection. Also, the night before surgery, you cannot eat or drink anything after midnight in preparation for surgery the next day. When you come to the hospital, you will meet several people that are part of our team. After you go to registration, you will be brought back to the pre-operative area. Here we will meet our pre-operative nursing staff that will help get you ready for surgery by placing an IV and give you some medications to help you relax. You will also meet the anesthesiologist who will go over their plan to keep you comfortable during surgery. Part of this typically involves a nerve block to help decrease your pain post-operatively and decrease the amount of narcotics that you may need after surgery. There will be more education on this during your hospital stay, but we do have an example of the pain block here. It's hooked up to this pain pump, which will be connected to a bag of medication that will go in a bag that you're able to carry. There will be more information on this to educate you more thoroughly on this during your hospital stay. All right, from there, we'll see you pre-operatively. Now, no one likes to talk about this, but I do want to talk to you about the risks of shoulder replacement surgery. This is not meant to be a list of things that scare you, but really just an understanding that there are risks to surgery. Vast majority of the time, everything does go just as we planned. However, having an understanding of the risk is important. Infection is always a risk with any joint replacement surgery. If a total joint gets infected, it can be very devastating. It can mean more surgery and more time spent in the hospital. Another risk would be potential nerve damage that would affect your ability to move the arm. Again, this would be a very rare complication. Some people may feel like the shoulder has more movement or even instability than they would like. A lot of times this can be treated with just physical therapy alone and strengthening up the shoulder. This may be interpreted as the shoulder sliding or moving. Other times, if it's more significant, the shoulder may need to be revised with more surgery. Shoulder range of motion after replacement surgery can be different for people. A lot of this may have to do with how much range of motion you have coming into the surgery. Some of it has to do with how your body may lay down scar tissue after surgery. A potential rotator cuff tear after an anatomic shoulder replacement may be a reason why a shoulder may be revised as well. Vast majority of the time, everything works just out as we planned. These are things, however, we should be educated on prior to surgery so that you do understand the risks. Coming out of the operating room, you'll have this dressing on. This is a brown rubberish dressing that will be over top of your incision that's generally about right here in the front of your shoulder. And this can stay on for 5 days. After 5 days, you can take it off, leave your incision open to air, and you are okay to shower and get it wet. You are okay to shower with this on and get this wet. That is okay. Again, this will come off 5 days after surgery and it just peels off like a sticker. If there's any concerns at that point, always give our office a call. But again, if it looks like it's well healed over, then you can just leave it open to air. There will be some glue over top of it as well to seal it shut. The stitches are all absorbable below the skin, and those do not need to be taken out. After your shoulder replacement and after your surgery, you will be brought over to the recovery room. If you're going home the same day of surgery, you will have an extended period in time in recovery, and then you will be discharged from here to home. We will work with the nurse to make sure you are up walking appropriately and safely. The nurses will go over all your discharge information. We do determine if you are going home the same day of surgery when you are scheduled for surgery. So this won't be a surprise decision made at the time of surgery, but something you and your family can plan for and know in advance. If you are someone that is planning on going to a rehab facility, then your stay in the hospital may be anywhere from 1 to 3 days. Otherwise, if you're planning on going home, we will discharge you the next morning, usually prior to noon or lunch. Obviously, all these things can be adjusted as we go along to make sure you're going home to the safest place possible and comfortable. After surgery, you can go ahead and start elevating the arm directly in front of you, and you can also go ahead and use it for activities of daily living, for light activities, buttoning your shirt, making some food in the kitchen. You can again start to raise it up directly in front of you. Out to the side is going to be much harder, and we can wait on that until I see you back in the office, but just try and raise it directly up in front of you. The other exercises that we would like you to do is to lean forward, and you can do some pendulum, what we call pendulum exercises. You just make your arm circles with counterclockwise and clockwise. You can also walk your arm up the wall if it's very sore by taking it like this and walking it up. You can slide it out on your kitchen table. And again, you are okay to actively try and raise the arm up. If it's too sore to do that, however, you can do some of these other exercises. The one restriction we put on is we don't want you pushing yourself up out of a chair and putting too much weight through it. And we also don't want you rotating the arm out too much in this direction, because it could create a little bit of instability directly after surgery. Other than that, we want you to keep the shoulder and the arm forward and in front of you, and you can start to use it. When it is time for you to go home, we want to make sure all your questions have been answered and you understand how the recovery process is going to work. Your arm will be in a sling after surgery, and you likely have had a block, or your arm will be numbed up prior to surgery from the anesthesia team. The sling helps keep the arm safe by your side while waiting for the muscles to wake up and the sensation to come back in the arm from the block. Typically, this takes about 24 hours. Once the block has worn off and you have regained your strength in the arm, you can start to elevate your arm in front of you as you tolerate. Okay, this is the exercises that you can do afterwards. You can also use pendulum exercises by just moving your arm in front and letting it hang, slowly making circles. You may use the wall to walk your arm up the wall and then let it slide down. We just don't want you to rotate your arm out like in this position, because it pulls on a muscle that it may repair, or it may put your shoulder in an unstable position. We'll see you back in the office in 10 to 14 days. At that time, we can determine if you're going to do formal therapy or not. Most people will require some formal therapy for 4 to 8 weeks, depending on the person, and usually you go from 2 to 3 times a week. People often ask what medications they can take for pain after the shoulder replacement. You'll be given a prescription for pain medication to go home. In addition to this, I also encourage you to take an anti-inflammatory such as ibuprofen in addition to your pain medications. This helps decrease the amount of narcotic that you need, hopefully avoiding problems with constipation and other negative side effects of medications. Taking a stool softener is also a good idea while taking narcotics. I do encourage you to take only as much pain medication as you think you need. Now to talk about your recovery and what to expect from your shoulder replacement. First, everybody does heal differently. These are general timelines, and most people fall within this description, but certainly some may take longer or shorter to recover. Your first post-op appointment will be about 10 to 14 days after your surgery. Here we'll make sure your incision is healing okay and answer any further questions you may have. We will also get an x-ray in the office of your shoulder. Then we will see you back at 6 weeks after surgery. At 6 weeks, most people have typically made a lot of improvements with both pain decreasing and range of motion improving. Most people are completely out of the sling at this point. It is very important to understand that your total shoulder replacement will get better for an entire year. Even at 3 months out from surgery, the shoulder may still be a little bit sore at times and still have more strength to gain. It's the scar tissue around the shoulder that gradually becomes less inflamed over this year. As the scar tissue continues to remodel and become less reactive over time, your range of motion in the shoulder and strength will also continue to make improvements as you get further out from surgery. Strength also will make your shoulder function better. This process will continue for at least a year out from surgery. Some people will have better range of motion than others, depending on how your body heals, but our goal is to get everybody to a functional range of motion for daily living activities. With a total shoulder replacement, you can participate in all low-impact activities such as hiking, biking, swimming, golf, bowling, and recreational tennis, just to name a few. You can also ski or work out with an elliptical or other low-impact exercises. The main limitations will be with heavy weight bearing, such as heavy labor or lifting heavy weights. These implants really are not made for this sort of stress and could cause you problems with the shoulder to wear out early. It also is important to know that while we are replacing your shoulder to get rid of pain and give you better function in the shoulder, it should not be compared to a normal shoulder. We expect overall the shoulder to last for about 15 to 20 years. If you're younger and getting your shoulder replaced, it certainly could need a revision or another surgery at some point in time. Again, as far as some of the laborers that may be getting a shoulder replacement, those questions are better answered on a personal basis, because I can go over exactly what you do at work and if the shoulder replacement will work well for you or not. But heavy labor, like such as even heavy weightlifting, total shoulders are not meant for that type of force going through it repetitively over the course of years. Okay, lastly, if you do have any concerns after surgery, I encourage you to call our office or the on-call doctor prior to going direct to the emergency room. There's always someone available to take a phone call 24 hours a day. A lot of times we can troubleshoot your concerns over the phone, answer questions, or even help guide you in the decision-making process of whether or not you need to go to the emergency room or not. Emergency rooms can be very expensive for you and very time-consuming with long waits, and can place you in close proximity to other people with infections, which we don't want. We want to try and avoid this for you if we can. Certainly, during business hours, our office is always happy to see you, and our nurses are available for questions over the phone. I hope this video has been helpful for you. Feel free to go over this information as much as you would like. If you have any other questions, make sure you reach out to our staff or myself and get these answered. I really want you to have a great experience with your surgery and to make this as least stressful as possible for you. Our staff is here to help you and take you through this each step of the way. I look forward to seeing you in your day of surgery.